I chose to be a nurse to help patients in the need and to make an impact on their care. I went through a CNA course in high school and knew that I wanted to be in the medical field and pursue nursing. My first semester in nursing school, my grandfather got pretty sick, and I got to see firsthand how nursing impacts patients. My grandfather ended up passing in the hospital, and I told myself that I could be a nurse to make an impact on patient care.
I'm a nurse because I love helping people and taking care of people. It's something I'm actually very passionate about.
Why am I a nurse? Well, that decision was made when I was in nursing school, and I finished my maternal child health rotation in nursing school, and I loved taking care of patients in labor, taking care of babies, taking care of moms after they delivered. It was something that grabbed me, and I've kept that love for 37 years.
I am a nurse because at first nursing was not my career choice. It was a door that opened and I took it, and I've learned to love nursing. It makes me feel good, helping other people, making a difference in their life.
I've always loved science, and I've always loved taking care of people. And what better way to do those two things that I love than to become a nurse? I've always been fascinated with the systems of the body and how they work and the challenges that come with that. And then on the other hand, I always knew, as far as a career went, that I wanted to have some kind of fulfillment. I wanted my career to be meaningful. I wanted to know I was making a difference in the world, even if it was just a small difference. I always wanted, I knew I wanted a career that meant something. So as a nurse, caring for patients, taking care of them, showing compassion to them, in their most life-changing moments, I get that. That's fulfilling to me. I'm going to say it kind of feeds my soul.
My greatest medical challenge has probably been the pandemic, among probably many others. I left home health the first of last year to come back to the ER, and it was scary. There was a lot of unknown, a fear of bringing it home to my family, the fear in the patient's eyes, hearing it in their voices of what was going to happen to them. It was pretty scary.
For me, my greatest challenge has been not taking work home. A lot of the times I get attached to my patients, and it's hard to turn it off when I get home.
My greatest challenge has been using our new systems to document care over the years. It's changed a lot, but like everything else, we learn how to do it and carry on.
I thought a lot about it, but I think as a nurse, my greatest challenge has been, over these last 4 years, just overcoming worry. As a nurse, you're always worried about your patient. It's there, it's in you. Even if you're given the best care possible, what the outcome is probably going to be, you're still, in the back of your mind, you're always worried. I told myself, just go to work, you and your coworkers take care of your patient, do your job, give 100%, leave the worry behind, leave that at home, and just do the best you can. And I did, and I still go home and I worry, but I'm able to now, I feel like I have a process, and when I get to work, my main priority is my patient, taking care of business, and then when I get home, that's when I do my worrying.
My greatest challenge has been being a nurse and becoming a mom, taking care of my patients for 12 hours and going home and having to take care of my kids. That's hard some days, but I've done it. And then another thing is coming off a day shift, going to night, and being that senior nurse. That can be a little scary because I'm used to having nurses who have 15, 20 plus years of experience and going to them for help that I need. And just not having that on nights, that was a little scary.
I feel like the fact that I do whatever I can to become a better nurse makes me successful as a nurse. And what I mean by that is I do whatever I can to learn the policies, doctors' preferences, and most importantly, I listen to my patients.
The most successful and proud I can be is when I've labored a mom all day long and she's finally had her baby and she says, "Thank you for taking care of me, and I couldn't have done it without you."
That's a really hard question for me to answer. I feel like being successful is pushing to do the best care you can for your patients. I'm eager to learn every day. There's always something new to learn. Respecting every department, respecting each other, working together. I think all that makes you successful.
What makes a successful nurse or makes me a successful nurse is not quitting, always trying to be better for my patients, always trying to learn better ways to take care of my patients, and not being scared because you mess up one time or you feel like you messed up. Just keep on going and growing. I think that makes a successful nurse.
I feel like it takes a team. And when I say that, I mean, if the building isn't properly secure, if it isn't cleaned or maintained, if the patient doesn't have the proper nutrition or the right medication, healthcare doesn't work. I've been at Titus for 4 years now, and I feel like I've always had an amazing team beside me. I've worked with an amazing group of people, I feel like we all know that we have to be lifelong learners. We're all open to new experiences, and we all work together. And I truly think that that's what Titus is all about. I feel like that's the epitome of what we are. We are a team. We work together, and I feel like I owe all of my success to my team.